Hello everyone, this is Chadi Alraies from ARCH 2023. I'm really privileged today to be with Dr. Ahmed Magdy. He is a pioneer interventionalist, and an international ambassador of SCI, as well as a well-known interventionist in complex coronary intervention. Dr. Magdy, so pleasure to be with you.
Thank you very much.
So we are on ARCH 2023, and this meeting I feel getting popularity every year.
Yeah.
So tell us about your experience and how did you come here?
Yeah, I knew Jasvinder Singh since 2000, and I joined La Sala, and actually I like San Luis because my brother lives here.
Oh, nice.
So it's very nice that they have intervention meeting eventually. The world is small. This meeting is growing, and I like very much the focused meeting on certain subjects in intervention where there is no many rooms. There's only one or two rooms, and they bring the most expert in each subject. I have the honor that I have been taken to give two presentations this meeting. One will be tomorrow about interesting and unique cases from the Middle East, where I share our experience from our area and Heart Institute, and the maybe the disease of the coronary disease is a little bit different in our area.
Exactly.
More extensive, more diffuse, younger age, and so I will share with them experience in some unique, unusual cases. So I congratulate Singh for the tremendous success he's doing every year, and I also appreciate that he's a very good expert intervention cardiologist. He does his cases with art, which I admire very much.
Absolutely. One of the things we spoke offline earlier is about the new initiative that you started at the level of Egypt as a country, and initiating a board certification and training for interventional cardiology. Can you tell us about this success story?
Yeah, actually, since I've been faculty in most of the world big meetings, and I've been traveling all the time, and so I started with the Egyptian Board of Cardiology in the Heart Institute where I work, and it was very successful. And then in almost 10 years ago, I was inspired by the American Board of Intervention Cardiology, American Board of EPS, of electrophysiology, the pediatric and imaging. So with my friends, we created the Egyptian Board of Intervention Cardiology. Mm-hmm. We started only with 12 people to train them for 2 years to work at the Heart Institute or some of the big centers. We give them the education, practical and theoretical, in the Ischemia Club, which became very well known since that time.
Absolutely.
Every month we do it once or twice.
Yeah.
And then these 10 people became 20, 40, and then this year we almost admitted 100 cardiologists postdoctor. They finished the PhD, the doctorate, or the Egyptian Fellowship Board of Cardiology, and they want to be consultant intervention cardiologists. They train for 2 years, they work, and at the end, this training includes Zoom meeting with world experts in each subject, which is unique.
Giving guidelines, going over guidelines, new trials.
And cases. Each session on focusing on some subject like CTO, left main, calcification, whatever. And we meet and we let people present cases from the professors and from the trainee. And at the end, they go for a tough exam. It's a written exam, MCQ and SE questions, and then oral exam by professors and by and also to see slides and videos. And then they go to do a case. This case is not a simple case. They do a case with challenges.
Part of the graduation
Part of the exam.
They have to do a case.
Yeah.
Wow.
And so I'm happy that we take people.
It's more cumbersome than the US board. Yeah.
Of course, somebody is standing beside the cardiologist.
But I mean, he's doing a case.
And on the other hand, you can think about this, that those are already intervention cardiologists who have been trained, but they need also to be certified.
Yes.
To be designated that they have this board of certification by the states. And then eventually in some of the countries around us, they do not allow people to do intervention cardiologists until they have this certificate, which we give by the Ministry of Health and by the Heart Institute.
So this accreditation became more international
Yeah.
as recognition for the training.
Yes, and then also those cardiologists, they come from all over Egypt. They are not university, or they come from different centers, and then they became the primary operators in their centers.
Centers.
And so the career have been changed to the better.
Exactly.
And we are
Because they go
proud.
back home and they teach their
Yeah.
institute.
We are proud of that, and our community is growing, and it's not what you did, but it is whom you taught and how they became.
How they become, exactly.
That's life. I'm also working with the Sky, as you know, it's international ambassador, and I've been doing a lot of work with them. I'm working with the European Association of PCI, with the acute cardiovascular care. Our role is to teach interventional cardiologists is not only to deploy stents, but to be good clinicians, a good clinical sense, and then put the stents, and how to manage all the situations, all the scenarios. That's what we teach them, and that's what we also learn from them.
Absolutely. It's a two-way path.
Yeah.
Well, Dr. Magdy, I mean, we need a 1 hour interview to cover all what you are doing.
Yeah.
But I mean, if you follow Dr. Magdy on YouTube or on the Twitter and Facebook, his profile always prolific, always bringing new technology as well as new meaning and education. Your passion for education is very visible. Thank you for watching this video, and watch this and others on the ARS 2023. This is Chadi Alraies. Dr. Magdy, thank you so much.
Thank you, Shadi. We are also proud of you and your achievements.
Thank you. Thank you so much.
Thank you.